My name's Bridget Organ. I'm the manager of St Vincents Mental Health in Melbourne. We've had a long-standing working relationship with Mental Illness Fellowship, but in 2006 they approached us to enter into a partnership around employment. So this proposal that Mental Illness Fellowship came to us with was about working more as a team and in a real collaboration and in a partnership that was quite strong and meaningful, so that it was beyond just that referral relationship and actually embedding services together so that that relationship was strengthened. So that was very different for us and quite new for us, and we hadn't done that before. So in practical terms, this means that we have a Mental Illness Fellowship employment specialist co-located in our community mental health services. So that person becomes part of the clinical team. They have an office, they're based there every day, they come to work there and be part of the broader team. So it means that rather than having a separate staff member that's outside of the organisation, they actually become part of that broader team, and they attend staff meetings and attend clinical meetings and really become part of the team, which is one of the key features of this program. Previously, if we were supporting a client to access employment or to pursue their goals in employment, we would have to apply to a mainstream service or another service outside of the services that we run. So this means that staff can now have that conversation and discussion with the employment specialist who is already present at clinical meetings and hearing about the goals and aspirations of the clients that we're looking after. There is a collaboration already starting from the beginning. There's no need to refer outside of the organisation. Staff have ready access to the employment specialist to work in partnership. On the other side, the employment specialist also is able to access support from the clinicians and case managers on clinical needs, so that they're not having to deal with crises and other issues that really detract from the employment focus, and can access that very readily. What it means we can offer to clients is a more comprehensive support to find employment. What it means is that the client doesn't have to tell their story to different people in different organisations. They come to the Community Mental Health Centre, meet with their case manager and the employment specialist, and that planning around employment happens together. Some clients, I've heard some fantastic stories of clients getting work and just it changing their lives. It's amazing what people can achieve and what it really means to them. I think that the main outcomes have been being very clear about the role of employment in our lives and what that really means to people with a mental illness, and how it can transform them to being a valued, worthwhile person. It gives them the reasons to get out of bed in the morning, to be part of society and mix with others, and to follow their achievements and dreams, whereas before I think they wouldn't have actually been able to take up that opportunity to actually find a job. The partnership between St Vincents Mental Health and Mental Illness Fellowship Victoria has really enabled us to work in a true collaboration and a true partnership, where we actually have staff co-located and are able to work and build on that strength. So for us, it's been a transformation for us in moving into that way of working with our PDRS partners where we hadn't done that before. And it has in fact enabled other programs to develop around that co-location and partnering with our PDRS partners.